What are your thoughts on the fact that the provincial government has reached an agreement with the association that represents family doctors to allow for quicker access to family doctors for Quebecers?
Well, my understanding is that it's an accord by principle. It has to be, agreed by all doctors. So I know there's like a tour from the association to meet doctors in different regions in the province. So it's not, it's not yet closed. It's not yet totally agreeable, but we're waiting for doctors to say what they have to say. I'm hearing different things, not necessarily in the direction of the accord, but let's wait for the procedure and the consultation made towards the doctors. What is interesting, for the first time for the past 25 years that I've been a spokesperson for the council, doctors would be agreeing to have pharmacists and nurses and also nursing practitioners to be able to admit patients, so that in Quebec we don't have always, like we've been doing for the past 50 or 60 years, having to have a doctor before being able to get any kind of treatment. So that's, for us, it's kind of a revolution, because I know in other provinces, like in Ontario, it's been like this for quite a long time, from what I hear. So that's interesting. And the other thing is that doctors would be helping the minister to register more than 500,000 more patients towards a family doctor. This is a challenge, but we're listening to the words and promises from the minister. Unfortunately, all these promises, are not all fixed. What the doctors are going to say, what kind of change you need to have in different structures of admission of patients in hospitals. So these are challenges that the minister knew about, because we're almost at 6 months from the election. So I asked him, I said, Mr. Minister, these are challenges and very important planning you're launching, but will you be able to show us any improvement in the waiting time for surgery, in the waiting time to see a doctor or a professional when we end up in a clinic or at hospital? Will we see any improvement in the waiting time for elders to get a bed in long-term facilities? If we don't see any commencement of an improvement from now to the election, Mr. Minister, with all due respect, I will have the feeling that this plan was more of a electoral pitch than a real commitment to start doing things. And his office has answered that, well, we'll have a lot of structures change. I said, you knew of all of those challenges before you launched the plan. Why didn't you wait? So the question is, with all due respect, I don't want to say that they are not of good faith, but I want to see some improvement. I mean, we've been talking about primary care access for so long that there's no reason why we cannot see any improvement. If so, we will say, well, you're going in the right direction. If we don't see anything, and the figures are not very good for the past month he's launched this plan, but we'll see. We have to see, and then we'll judge.
Thank you so much for your response. In regards to the waiting time, I've just been thinking about, it's been a constant subject during the pandemic, how overloaded ERs are. But would you say that prior to the pandemic, this was an issue? And if it was, is it related to the lack of access to family doctors, possibly leading people to go to ERs when they should be going to see their family doctor?
Yeah. Well, it was an issue before pandemic. Now it's only worsened. Primary care access has been a topic of discussion for at least the last 10 years. But you're right in saying that people end up at emergency wards because they cannot see their doctors. Half of the patients who end up in emergency wards have already a family doctor, but they can't see him or her. Worse than that, on the 13th of March 2020, there was the decree from the government allowing doctors not to see their patients, but only to call them, pardon, and be paid the same token. So some doctors working in emergency wards in last spring and spring of 2021 were furious. There was, what the hell are you doing here? You have a family doctors, and patients with their kids sometimes said, well, we couldn't see our doctor. He was only available on the phone because of the decree of the exemption, which is, to me, totally scandalous. So it's a topic at least 10 years old, and we hope that because of the new multidisciplinarity that we're introducing in the accord, this is first that I see in such an accord, if doctors agree with it, that maybe, hopefully, will help, accessing faster to primary care. And according to the ministry's figures, 50% of patients who end up at emergency wards don't have to see a doctor, could see another type of professional, social worker, pharmacist, nurse, etc. So we're really, finally working towards something good. If I can see some improvement, please.
Thank you so much. Just in regards to there being a lack of access to a family doctor, do you think that this limits many things, but just for example, maybe early screening for skin cancer, any type of cancer, things like this?
Oh, yes. Oh, yes, absolutely. And I was talking about the waiting time for surgery. That's exactly what I'm talking about. And some oncologists have even said publicly that by this kind, we're up to 150,000 patients waiting for surgery. And among these patients, you have oncology patients, you have cardiac. And what doctors are saying is that yes, the tracing of cancer is postponed towards a lot of patients, and we're shoveling snow in front of us. We're not helping. We're just pushing the problem farther, and with all the honesty that they can be talking with, doctors are saying that we will not see the end of these lists unless there's a very important reorganization, and certainly more efficient than what we've been seeing now. Yes, there was a pandemic, but before pandemic there was 100,000 patients waiting for surgery. Now we're up at 160.
Maybe this is a difficult question to answer, but do you think that if this promise is put in motion, how early do you think we could begin to see more access to family doctors for Quebecers?
Well, I challenge the minister. I want to see the figures going down by now, not after the election. Otherwise, we will be concluding that this was not a plan. This was a political and electoralist pitch. So I want to see the figures now, and we're waiting for new figures in the coming months. For waiting time in surgery, waiting time on stretchers, waiting time for surgery, and waiting time for a bed in a long-term facility. I want to see, better figures to start with. I know we're not gonna, come down to the list. I'm just saying I want to see the improvement of the figures. If they don't, the ministers, with all the excuses that his office has given us, which he already knew about before launching the plan, will be on his shoulder. And with all due respect, we've never been shy of denunciating things that were more political than towards efficiency and certainly better access for patients. That's our only modus operandi or vivendi, is to take care of patients. We are a militant. We are an advocate for better care for patients for almost 50 years now.
What do you think is the root cause of the fact that it's so difficult for patients in Quebec to access family doctors in a timely manner? I'm sure there's a
Listen,
few.
I have not studied other provinces, but I know certainly that in other provinces you have other professionals admitting patients. Let's state the fact that the nursing practitioners are already working in hospitals, are already authorized to have their own clinics, which was totally unthinkable of until a few months ago. So now, just the fact that we will be able to admit a patient not having to wait for a doctor necessarily, unless he has to be seen by a doctor. So that will certainly be an improvement if doctors agree to share the admission process with other professionals. And I heard the chair of the new chair of the Association of Family Doctors saying, well, we won't be able to do it on our own. We need more. That's the first time I hear any union representatives of doctors saying that kind of stuff. So this is positive. How is it going to end up on the field? We need to see.
Do you think that there, over the past few years or past few decades, budget cuts to the healthcare industry in Quebec, do you think that there's a link between this and just doctor shortage of access to doctors?
Well, according to the figures, we have as many doctors as there are in other provinces. Actually, our doctors are paid at least the same amount than the most paid doctors in Canada. So to me, this is not a question of money. But doctors have been, like gods since the beginning of the social insurance laws and services in Quebec. Now we're starting to see and hear doctors being open towards other professions. So that's certainly a change in our mentality, but we need to see some improvement. And there's a lot of bureaucracy. I don't know if it's the same in other provinces, but we have so many people working at the ministry and different regional authorities. Sometimes, we fight for patients for different services and stuff that they're not getting. And sometimes it is so complicated for sometimes things so simple. So that could be the worsening of the bureaucracy in the past couple of years. But it would be interesting to have a study, among all the provinces. How many civil servants, how many bureaucrats do you have? People who don't touch the patient. How many of them do you have in other provinces compared to Quebec? That would be interesting to have.
I'll try to look into that. Yeah, that's a good idea. And then, almost done. Sorry, many questions. I just wanted to ask in regards to doctors being more open to other professionals seeing their patients. Is there a certain culture shift that has led to this, or just any reasoning as to why?
I want to believe it, but I want to see it, because the accord was not yet agreed by doctors. It is in the process. And there's also Bill 11, which complicates a little more the agreement of doctors, because the minister, by virtue of this new bill, would want to have a total access to the appointments that they have day by day. So it's kind of more controlling, because the government pretends that some doctors are not totally available to their patients. So that, of course, is creating a lot of disagreement among doctors. So all this context might slow the fresh change in mentality, but we'll see what happens. But to me, if the minister launches a plan, he knows about all of those challenges and he needs to deliver. I trust that he seems to be of good faith, but he's also a politician.
Is there any other, I mean, I guess there's maybe a few things you could say, but I guess is there any other points of interest just in regards to how the Quebec government could improve access to doctors and just overall improve the healthcare system so that, you know, we just have better access, more access, things like this?
Well, 25% of beds being occupied in hospitals in Quebec are occupied by elders who either are waiting for a bed in long-term facility or have not been treated at home, like doctor going to their home could facilitate, like it used to be like 40 years ago. If you solve this 25% of beds being occupied by elders, you accelerate the waiting time on stretchers in hospitals emergencies. You allow patients who really need hospitalization to be, transferred up in a bed in the hospital. You are slowing and diminishing the crisis at emergencies. You are treating elder patients who cannot move at home other than having them transported by ambulance every time that they don't feel good, which is the case as we speak. So imagine having the doctors going back to elders' residences and homes. That's another challenge, but the minister has not talked about that yet. But for us, these elements are all connected. If you start solving one or two of these elements, you're solving even more of other elements that are required to finally have access to primary care and not having a crisis in almost all emergencies in Quebec, which is quite unique according to what I'm hearing from other emergencies in Canada. But we are unique, as you probably know. We're distinct and unique. I'm being a little sarcastic here. I don't think in terms of access to care. Come on.
Well, thank you so much for your time.